Ladies and gentlemen, I am Destia Izzati from Public Health Faculty in Jember University. Thank you for this opportunity to become delegation from Indonesia. I would like to explain about undernutrition problem, especially stunting. In 2016, 87 million stunted children lived in Asia, 59 million in Africa, and 6 million in the Latin American and Caribbean regions. In Latin America and the Caribbean, stunting has declined twice as quickly as in Africa from 2000 to 2016. However, the reduction of child stunting has not been the same in all groups of the population. For example, from 1990 to 2030, in the Asia-Pacific, Latin America, and Caribbean regions, child stunting declined more in urban areas than in rural areas. Also, most countries experiencing protracted crises are, of course, to meet the World Health Assembly stunting reduction targets in populations where moderate and severe child stunting are highly prevalent. Based on data from the Indonesian Toddler Nutritional Status Study in 2019, the prevalence of stunting is currently still at 27.7%. World Bank data for 2020 shows that the prevalence of stunting in Indonesia is at 115 out of 151 countries in the world. Stunted children with deficiencies of iodine and iron may suffer irreversible brain damage, impeding them from reaching their complete developmental potential. They have a shorter adult height and a higher susceptibility to chronic diseases in adulthood, lower attended schooling, and reduced adult income. Stunted and wasted children also have a higher mortality risk, which is increased when the two conditions coexist in the same population. Increasing women's literacy rates isn't enough protection against child stunting on its own, as there are other related factors that are important for reducing child stunting, such as income distribution, government's expenditure on social services, the proportion of the economy devoted to agriculture, immunization rates, and access to safe water. A low family income and poor living conditions increase the risk of child stunting as a result of high food insecurity, low access to health care, unhealthy environments, and a high risk of infections. To reducing the stunting problem, World Health Organization provide recommendations for all countries in the world. The recommendations are: first, energy and protein supplements for women. The second is community-based platforms for nutrition, education, and promotion. The third is government commitment and focus on equity. And the last, fourth, monitoring health inequalities. To realize the achievement of the Sustainable Development Targets or the 2030 Sustainable Development Goals, the government of Indonesia has established stunting as one of the priority programs. The efforts made to reduce stunting prevalence is focused on the first 1,000 days of life, include the following. First, specific nutritional intervention, including supplementary feeding to overcome chronic energy deficiency in pregnant women, blood supplement tablets for pregnant women with anemia, and the third, consumption of iodized salt, and breastfeeding until the age of 2 years, accompanied by adequate complementary feeding, zinc supplementation, washing hands properly with soap and flowing water. And the second is sensitive nutritional intervention, including supply of clean water, personal hygiene and sanitation, fortification for food security, access to health and family planning services, national health insurance, maternity insurance, and other social security, parenting education, and the last is sexual and reproductive health education and nutrition for the adolescents. Ladies and gentlemen, optimal nutrition intake for stunting prevention can be carried out with the national movement to accelerate nutrition improvement based on the state's commitment to improve the quality of human resources. With programs and assistance from the Indonesian government in overcoming stunting, as well as cooperation and support from the community, I believe Indonesia can definitely be free from the problem of stunting. What should be prioritized is public awareness to always live a healthy life, especially for pregnant women, so that the future and development of children can be up to.